So let me bring Nick up. I wanted to have kind of a broad spectrum presentation today, presenting some research. Nick has been in the field and then putting a face to the deal. So Nick is with the Scripps Research Institute, homegrown. You know, Barb Mason, who's there, did some great cannabis research studies. He's going to share his experience.
So just kind of my hope was to be brief, but to put a lot of the wonderful literature that Dr. McDonald reviewed, put it into a bit of treatment context. So the one thing I want people to take home with them is you need to respect the withdrawal process in the treatment process. It wasn't until the DSM-5 that even our profession respected the fact that there was a withdrawal process for people going through cannabis dependence and trying to abstain. So just a little bit about this. With the withdrawal process, we typically look at it as the traditional acute withdrawal. You know, 2 to 6 day period, you're experiencing the acute phase of appetite down, weight loss, moods down, sleep's disrupted, all those common understandings. The other piece that we don't really tend to recognize and what we tend to focus on in our work is something called protracted withdrawal. And what a lot of people don't understand is that as a person is attempting to abstain from a substance that they've been dependent on, this protracted withdrawal process lasts 15 to 18 months. We're talking over a year that a person is still seeing deficits in executive functioning, still seeing deficits in mood and sleep. They're still having vivid dreams. They're still having insomnia. Their mood is still much lower than baseline. And they're having a hard time making decisions, being goal-oriented, focusing on multiple tasks at one time and being successful in their life. So this is a really important process to address within the treatment phase. So what we're doing in particular is looking at novel uses of existing medications to help with this physiological withdrawal process. So the one we're looking at right now and have looked at in the past too to build a bit more foundation for what we're doing now is gabapentin. It's a drug that's been on the market for a long time. We know the safety of it. We know that it's very well tolerated. General practitioners tend to prescribe it off-label all the time because of this. It's a very safe drug. It's a very effective drug. It helps with a lot of those symptoms that we were talking about with withdrawal, both acute and protracted. So it can help with depression. It can help with anxiety. It can help with insomnia, all of these things. So that kind of part and parcel was the reason why we chose to look at this drug. Now, a little bit of data from the research. So what we ended up doing, you'll see down here, it might be a little bit fuzzy from far away, but these are weeks below here. So it was a 12-week treatment study. They got either placebo or they got the gabapentin medication, 1,200 milligrams, but everybody got state-of-the-art motivational enhancement therapy, cognitive behavioral support as well. So everybody got psychotherapy, only half of the people got the drug. And let's look at the outcomes. So it gets a little confusing, but right here, we're going to be looking at grams smoked. And right here, we're looking at the urinary content of THC. So how much is actually still in their system? Because sometimes we see, discrepancies in self-report and actual how much is physically in the system. So we see that there's a significant improvement for people on gabapentin, that they're smoking far less as the weeks go on. There's far less in their system. And at the end here, we see that many people are abstaining. Many people have maintained abstinence. Now, it's a different model of treatment that we're approaching. We want abstinence. And there are a lot of different fields of approach and how you might treat people with substance use disorders. Some say moderation might be effective. Others push abstinence. We push abstinence just to better understand the biological mechanisms of the drug and something that might be of help with that. So something else that we saw, days per week. And Dr. McDonald was kind of talking about how that can be a very important outcome for some adolescents. How frequently are they using this drug? Well, we found that the people using gabapentin used it far less. And the really interesting fact, some of those protracted withdrawal symptoms. So we looked at withdrawal on the top left. We looked at sleep quality in the top right. We looked at craving in the bottom left. we looked at depression in the bottom right. And we saw that across the board, those who were taking gabapentin throughout the study experienced far less of those withdrawal symptoms. And in our eyes, that was quite related to why they were able to abstain so much better. They didn't have to struggle so much with this withdrawal process that not just spans the acute 2 to 6 day period, but can span up to over a year at times. So it's a very kind of specific way of looking at treatment with cannabis dependence. It's looking at a very specific medication. But the take-home broad message is respect this withdrawal process. It's so related to people relapsing. I mean, if we look at basic behavioral concepts, it's negative reinforcement in action. If a person is withdrawing, they're experiencing this for up to a year, it's very easy to go back to the drug that would get them back to what their brain now knows as homeostasis. So as you go forward, as you work with people with cannabis dependence, we really want you to emphasize that withdrawal process. Talk about it in the session. Talk with people how to cope with it. And if necessary, if they're struggling, you could even consider talking to them about medication. There are some medications, we're looking at 2 right now in our lab, that show some efficacy for people coming off of cannabis. And my guess is, like Dr. McDonald was saying, as the years go on, this is going to become a bigger issue, and you're going to see more and more treatment options coming out on the market as far as pharmacology goes.
And yeah, my name's Jason, and if it was a different meeting, I'd say I'm Jason, I'm an alcoholic. I went through Lasting Recovery. Judy, thank you for asking me to come here. And yeah, my perspective is very on track to what you guys were talking about, with especially with regard to withdrawal. You know, I hit a really hard wall at about 10, 11 days. You know, where the irritability and depression really came to me hard. And you know, thank goodness I was in a recovery program where you know, I was told it was normal. You know, and I tried that on my own a few times, and by the time I got to about 9, 10, 11 days, it just, you know, my wife actually wants it here to smoke because you're way too much of a jerk. So, you know, it's nice to get the educational component and learn exactly what was happening to me. And I've been sober now for 3 years, 9 months, and 16 days, but who's counting? And I really am grateful for going through the program and learning a little bit more about the cognitive reasons behind the addiction of what, you know, what I was doing. Cannabis, marijuana, that was my drug of choice. I call myself an alcoholic. I think that's kind of the parent term for, you know, whether it's heroin or pills or marijuana or alcohol. You know, that's my experience. That's my opinion, is that it was this escape. You know, it's this escape from my problems, my issues, from me. You know, it's escape from me. And you know, I'm a married man. I've got 3 children, and I sold a business. And yeah, it was time to party. And there was a lot of entitlement and a lot of you know, reasons that I should be able to, you know, escape and have fun. But it led to, you know, the exact opposite, which was depression and anxiety, which you guys both spoke of very well. And you know, so, you know, I think Judy, going through Lasting Recovery, described it as, you know, people start out as a cucumber, you know, and you put a cucumber in vinegar for long enough, it becomes a pickle. And so now, as a pickle, you know, I can't touch the vinegar again, whether it's my alcohol or my marijuana or whatever the drug is. You know, I have to stay abstinent. I don't believe in the, you know, moderation part. Again, that's my opinion, but that's what I've been shown, and I've seen when people have been introduced to their drug of choice again, or even a different one. You know, they'll transfer, and I've seen people die because of it. You know, in my program that I'm in now. So. You know, with regard to, you know, my recovery and what's happened, you know, I'm just grateful to be off of marijuana. You know, it was definitely something that for about 4 or 5 years after I sold my business, it's, you know, slowly turned into this isolation. You know, if I was you know, if I was parenting my kids, it was to put them off to bed so that I could go do my thing, and you know, led to a lot of friction, and I needed to hit a bottom. And I think that's, you know, to talk about what you guys are all doing for a living. You know, unfortunately, you can't chain someone up and tell them don't do it. You know, they have to hit some kind of bottom. And I was talking to a couple people before the meeting today that, you know, unfortunately, we just have to hit some kind of bottom. For me, you know, it was divorce and losing the kids and, you know, losing half my money. What? You know, it's, you know, it was enough to get me into recovery and look at myself and look at my own issues and my own addiction, and then take the next step to take care of that. Yeah, so, you know, on a personal note, you know, my daughter, my oldest daughter is 16 years old, and this summer, you know, she tried her first hit of marijuana. Hit home. You know, it's my drug of choice. And, you know, I want to chain her up. Right? I want to tell her not to do it, and to hear some of the information, to give her, you know, some of this information is so valuable. So I appreciate the insight. But I know that, you know, at the same time, you know, she will follow her path, as many close to us will follow our path, and many patients will follow their path. You give them the information. You cannot you can lead a horse to water, right? You can't force them to drink, kind of a thing. And that's, you know, that was my experience, and that's yeah, that's where I'm at now. Thank God I found recovery. It's my life has turned around. You know, that's the nice thing about it. You know, once I get past that craving and that mental obsession, you know, with whatever, you know, path I've taken to get there, it has allowed some motivation to come back into my life. I've tried a few different entrepreneurial ventures, and now actually my wife is working, and I'm the stay-at-home father, which is just fantastic. I can spend time with my 3 daughters and be effective and useful. So, anyways, thanks for your time.
Yeah.